Siegfried, the floor is yours.
Okay. Good afternoon, everyone. My name is Siegfried Moder, and as FEE President, I am pleased to welcome you to this joint webinar organized by FEE, COPA-COGECA, and FESASS. It is encouraging to see many colleagues joining us today, veterinarians, farmers, policymakers, and partners from across Europe, all sharing a commitment to strengthening preventive animal health visits as a foundation of sustainable livestock management. Preventive health visits are not merely a regulatory obligation, they present a shared commitment to animal health, farm resilience, and public confidence in our food system. Today's discussion brings together three essential dimensions: policy, knowledge and skills, and field practice to advance a more coherent and collaborative European approach. We will consider what is working well, identify remaining challenges, and explore how preventive visits can deliver their full value for both animals and the people who care for them. Our speakers and panelists reflect the diverse expertise of Europe's veterinary and farming communities. I look forward to an insight and constructive exchange that will help translate shared ideas into practical progress. Thank you for your participation, and with that I will hand over to Jane to begin the program.
Thank you, Siegfried. And for those of you who don't know me, my name is Jane Clark. I'm one of the vice presidents of the Federation of Veterinarians of Europe and the director of veterinary services in the Food Standards Agency in the UK. Siegfried is going to have to leave us partway through this meeting to get on a flight. But thank you so much for your introductions. Really important webinar that we're delivering today. The housekeeping rules have been put in the chat by Wiebke, but just as a reminder to everyone, the webinar will be recorded and the slides and recordings will be shared with all of the participants, as well as, we hope, a YouTube video being shared as well and published. In order to ask questions, please use the little Q&A box at the top of your screen rather than the chat. That is where we will go to look at the questions, and also we'll be able to answer some of those questions if we do not get a chance to deal with them in the panel discussions. We will try to answer all of those questions offline if there are any outstanding. And with that, I'm going to ask if Barbara Lugar could turn her camera on and start to, hi Barbara, to share her screen. Barbara is the Deputy Head of Unit for Animal Health at the European Commission. I'm really delighted that she's here today. She holds a master's degree in veterinary medicine from the University of Ljubljana and has expertise in veterinary medicine, animal behaviour, EU policy, stakeholder engagement and regulatory affairs. So Barbara, thank you very much. I'll let you put your presentation into presentation mode and hand over to you. Thank you. Oh, we can see your next slide on that version.
All right.
If you have any notes that you don't want to share with us, you might want to change it to a different presentation mode.
No,
because we can
I would
see.
like just to, no, I have no notes. I would just like that you have a proper version, but I don't know. So maybe I stop sharing and I try to share
again.
Another slide, right?
Perfect, thank you. And Wiebke may be able to
well,
help.
What about the?
That's perfect.
That's perfect.
Perfect. Thank you.
So thank you very much. Thank you very much, Jane, for this introduction, and thank you very much for the FEE, FESASS, and COPA-COGECA for organizing this webinar on animal health visits. Jane already introduced me. I'm from the European Commission, and I work in the unit of animal health, amongst others on the animal health law, and where we have laid down certain rules about animal health visits, and the organizers have asked me to share few reflections from the Commission side on those animal health visits, and this is my intention to do so today with you as a start for the discussion. So what I will share in these 10 minutes with you very fast, I will say a few words about the purpose of the animal health visits and how we see it and the context in the context of the animal health law. Then I will say something about animal health visits as a part of operator surveillance. You will see that we consider this as a very important element. I will mention Article 25. This will be not new for you, but highlight certain elements to remember. And the organizers have also asked me to put up some points related to the animal health law evaluation and some preliminary conclusions, especially in respect of the animal health visits. So, purpose and the underlying concepts. The animal health visits in the animal health law basically lay on two big pillars, I would say, on the prevention and on the responsibilities. And with the biggest importance and the emphasis there is prevention, certainly. And here I have highlighted in blue color the three elements that are really intrinsic part of the animal health visits, which are surveillance, biosecurity, and knowledge on animal health. And on the other hand, we have their responsibilities, and the main responsibility here you will see goes to the animal keepers, to the operators, and the second line, these are animal health visits, is related to the role of veterinarians. Oops. So, surveillance in the animal health law is structured in different layers, and the important thing that I want to share here with you is related to the fact that we are all involved in the surveillance of animal diseases, and it's responsibility of everybody, and everybody plays a role in it, an important role with it, and without another we cannot work. So operators, they have their own surveillance, and this complies also animal health visits. There is surveillance by competent authorities, and of course EU has also a role with our union surveillance programs. On the operator surveillance, few words as an introduction to the animal health visits, that operator surveillance is key, is in fact essential to detect the presence of all listing and emerging diseases, and also beyond, not only those. And this is set out in one of the articles of the animal health law. And this can be achieved through observing health and behaviors of their animals, observing changes in normal production parameters, looking for abnormal mortalities and other signs of serious diseases in animals which are under their responsibilities. And as a part of this own surveillance, operators must also ensure that the establishment receive visits from a veterinarian under certain conditions, and this is set out in Article 25 of the Animal Health Law, and this is the main point of discussion, let's say, at today's webinar. The visits, what this legislation says there, that establishments must receive visits by veterinarians, but following certain criteria. So it's not like automatic outbound requirement. Taking into consideration the risk posed by the establishment in question, the type of the establishment, the species and categories of animals or products that are kept at the establishment, the epidemiological situation in a given time, and any other relevant surveillance or official controls to which the animals and the type of establishments are subject to. Meaning that if there are frequent official controls or there is any other risk-based surveillance, so the volume and the frequencies of such visits should be adjusted to this. The objective of visit is to contribute to the prevention of animal diseases through what we like to put in the first place, also, although it's not so in the legal text, is the detection of and information on signs indicative to animal diseases. And the second thing, which is also very important, is the provision of advice and knowledge sharing on biosecurity and other animal health matters that are relevant to the establishment in question. And those matters are also provided for in earlier articles of the animal health law. So the visits are intended to help the operator. So that's the first thing that we need to retain. And the frequencies of animal health visits should be proportionate to the risk and take into account other own existing surveillance at establishments. So, for example, I have put one example here. There are, for example, approved poultry establishments that they have to have, for example, a certain surveillance scheme in place if they want to trade with other member states. Of course, such establishments already have their own surveillance and are possibly visited by own veterinarians, and this can count as an animal health visit. Animal health visits can be combined with visits for other purposes, which includes, I don't know, self-controls. It includes the use of veterinary medicines, could be also for animal welfare purposes or for other. So it's completely open. And the Commission can develop rules for uniform application of this article. And the Commission has not yet developed the rules so far. Why? And we are open to develop and can be developed, but we are willing to develop them only if rules are meaningful and not creating more prescriptive or too burdensome system than necessary. So that's our line. So we are listening to everybody, but so far we have not reacted by an implementing act. Further elements that I would like you to remember, that animal health visits are part of operators' own surveillance and controls. That's important. Animal health visits are not official controls. Should not be confused with that. There are several folds in which the visits can take place, and the visits by private veterinary practitioner is just one option amongst others. I mentioned earlier that there are own controls that are in place in certain establishments, and of course this is also a valid possibility. Competent authority should, when conducting its surveillance, whenever possible and appropriate, make use of the results of operator surveillance in animal health visits, and this is laid down in Article 26 of the Animal Health Law. So these visits have to be taken into consideration seriously, and animal health visits can be a part of risk-based surveillance, and we have some good examples, for example, on this in particular in the aquaculture sector. And then a few more slides on the animal health law evaluation and animal health visits, and these are just preliminary results. We are still, we are at the end of the study. We are still assessing and the results. So please consider these results here preliminary. A study to support the animal health evaluation shows that the structured regular visits are introduced in 18 EU EFTA countries, approximately 58%, so over 58% of the member states, mainly for major livestock species. Systems and applicable and approaches vary between countries. The visits are conducted by private, official, or mixed veterinarians. Payment also differs, sometimes by farmers in 44%, by the state 22%, and some others did not specify. There was another questionnaire circulated to the EU CVOs. This was done by the Hungarian presidency very kindly. And the results of this questionnaire showed also that about half of the corresponding member states already have in place minimum requirements. And this information corresponds to what we see the study, that 2/3, 16 member states, see a need for harmonized minimum requirements at EU level. The majority of them, of those responding, are in favor of guidelines, and fewer prefer harmonized legislation. Half of those that prefer harmonized legislation already have some minimal national requirements in place. Then costs and benefits. Okay, this is an important and interesting topic. So on the cost side, a majority of, again, this is preliminary. On the cost side, a majority of respondents reported higher compliance costs. Small farms without quality schemes, that I mentioned earlier, yes, bear the greatest burden, understandably. On the benefit side, farmers question sometimes cost-benefit balance, and they often see more administrative burden than added value, and they ask for clearer implementation guidance. These are their observations. Veterinarians were generally supportive to these visits as a biosecurity tool, but want more flexibility and risk-based frequency. They are, on the other hand, divided on certain aspects. Some note better cooperation with farmer and competent authorities. Others point to unclear roles, veterinary shortages, and uneven enforcement. Competent authorities value the visits for prevention and early detection, but raised the administrative burden, uneven implementation in member states, and unclear guidance as well. Non-governmental organizations have stressed enforcement gaps and inconsistent biosecurity checks. And this brings me to my last slide for this warming up and introduction, which is related to the AHL evaluation. And my last point, that in summary, overall, everybody acknowledged the value of animal health visits, but on the other hand, several call for clearer guidance, and some of them for harmonized minimum requirements, and the others calling for greater flexibility. And then here we are in the Commission. This is a challenge for the Commission to accommodate how to move forward. So we are very interested to hear the discussions today and the ideas behind that can be shared with us to help us overcome this challenge. Thank you very much. I hope I was not too long, and back to you, Jane.
Barbara, thank you so much. We gave you 10 minutes. We were running a little late ourselves, but we'll catch up that time. It was really important to hear from you. And Louise, thank you, is turning on her camera and getting ready to share her presentation as well. Please, can people put any questions they have in the Q&A? We will deal with those in the panel discussion rather than taking them as we go along. So Louise, while she sets up her presentation, has previously worked as a small animal practitioner before joining the Danish Veterinary and Food Administration in 2023. At the DVSA, she works at the Animal Health Unit on notifiable diseases, legislation and biosecurity. And fascinatingly, in 2024 and 25, she was deployed as an expert on biosecurity to China and Indonesia as part of a strategic sector cooperation, and is currently working on a project focused on the implementation of biosecurity in Denmark and serving as a representative on biosecurity during the Danish EU presidency. So, Louise, thank you so much for joining us. I will hand over to you to deliver your presentation. Thank you.
Yeah, thank you so much, Jane, for the introduction. That's very kind. Yeah, my today's presentation is on the topic strengthening animal health and biosecurity through co-creation. And as we talk about animal health and biosecurity, for animal health, it is essential for ensuring a safe, healthy, and sustainable food system, both for the benefit of animals, people, and also the environment. But ensuring animal health, that is not possible without talking about biosecurity, as biosecurity lays the foundation for this disease prevention and disease management. And as we just heard before by Barbara, we have these regulations in the animal health law. And here the responsibilities are clear in where they lie. It's between the authorities, operators, veterinarians, and etc. But a challenge is bridging the gap and turning what is written into action. And in other words, the implementation. And this always will raise the question, then how do we do it? How do we ensure this implementation? And this question leads me onto the topic of today's presentation, which is co-creation. Now, co-creation refers to the collaborative approach where public and private partners work together to develop practical, science-based and effective solutions. This collaboration can involve to different degrees, both authorities, veterinarians, farmers, the industry, and etc. But the concept of co-creation, or at least as we know it in Denmark today, this has been developed over the past 200 years. And initially, this all started by farmers creating cooperations across different sectors in order to promote a higher production quality. And since then, the authorities became more involved as they began regulating, and later on, Denmark also became a member of the EU. But I would say that for the past 25 years especially, this concept of co-creation as we know it today, where we have good collaborations both globally and nationally, they have been developed over this time. So this means that we, at least in Denmark, we have a historical tradition of collaboration. And this is between both authorities, farmers' unions, and other stakeholders. And this means that we do today have a joint development when it comes to national action plans. We, as an authority, are the ones who initiate and finance national action plans, but they are implemented in partnership with the industry. And this means that we have a shared responsibility for the implementation. And here the industry is often responsible for the day-to-day administration, and sometimes they also finance initiatives on their own and in supervision of the authorities. But even though we have this shared responsibility, it will be the operators who have the overall responsibility to ensure that they comply with the rules according to the animal health law. And the DVFA, of course, ensures this compliance by doing these official controls. But the question is then, how does this co-creation actually look like in real life? And for the next part of this presentation, I would like to divide this co-creation concept into two main categories. We have one category where co-creation is driven through a legal requirement, and we have co-creation that is driven through voluntary practices. Now, to start off by giving an example of the first, the legal requirements, I can mention what we just heard Barbara also talk about, which is the animal health visits. In Denmark, we have a special type of animal health visits called a herd health advisory agreement. And we've had these since 2010. Professional farmers and veterinarians collaborate under a legal requirement for these exact visits. And this means that farmers have a formal contract with a veterinarian who then must visit the herd regularly to provide advice. Now, the frequency of these visits are determined by the herd size and also the type of agreement. And the agreement that the farmer can choose is based on to what level of degree he wants to be able to initiate antibiotic treatments on his own. But when the veterinarian comes and does these visits, which are mandatory, the focus is on animal welfare, animal health, can be on mortality rates, production, antibiotic use, and also biosecurity. So this is one example of a co-creation that is driven through a legal requirement, but it is still a co-creation. Now, to take a look into the opposite, which is the voluntary practices, I can begin to tell you about this we call the industry code of practice. And some of you might also know this from your respective countries, but we have a industry code of practice in Denmark, which is a voluntary standard that is developed by the industry, and it is for the industry to promote high standards. It is a framework that complements the official legislation and translate the legal requirements into more practical and actionable guidance. And this helps the farmer understand and comply with the rules and take active responsibility for maintaining these high standards. And it also provides them a structural framework to self-regulate. And now the pictures that I have here on this slide, when you take a look in the top right corner, there is a picture of a sequence of settings that is describing a system from hatchery to supermarket. And this is within the poultry industry. This is examples of an industry code of practice that we see in this poultry industry. And they also have several different documents that, for example, can explain and write down what you need to do for a facility in order to organize yourself, what things you need to be aware of, and etc. And this is all in the pursuit of maintaining this high quality. Now, at the bottom right corner, we have what is called the SPF SUN. And the SPF SUN stands for specific pathogen free. And this is a specific form of system that we see in the pig industry in Denmark. And again, it is a voluntary system for farmers to do. So if they choose to enroll in this kind of system, then of course there are mandatory demands that they must live up to. But it is still in the pursuit of maintaining a high quality. Another example, which is a little bit more recent on a co-creation that we have in Denmark, is a campaign called Take the Infection by the Horns. And this campaign was launched in 2022 by a group of stakeholders within the cattle industry. And it's actually a campaign that still runs today actively. It involves stakeholders that is from both the Danish Veterinary Associations, Danish Agriculture and Food Council, which is a farmers union. We have also from COPA-COGECA Innovation and other partners in the industry. And the purpose of this campaign was to raise awareness on biosecurity in cattle farms as they saw a need for it. They had a purpose of promoting effective and easy to implement solutions for everyday farm routines. And a very, very important part of this campaign was to make sure that all stakeholders at, but also around the farm were engaged. So this means that it is not only the veterinary advisors and farmers, it's also technicians, transporters, visitors, and all kinds of people that can come into contact with the farm. Now, in practical, this has been boiled down to some very easy to understand guidance material, and everything is publicly available. And what they have done is that they have created some specific guidelines for example, a farmer who is trying to prevent diseases. Then they have a guideline for that. Then they have created a guideline for example, a supplier who comes to the farm in order to deliver or take away some of the things that they have. What do they need to be aware of when they come to the farm? It is some examples, as you can see here in the middle, very basic posters, but posters that you can hang up on your farm. So when people come to the farm, it is very easy to see what you need to be aware of before you enter the farm, before you enter to the animals, and also before you leave the farm. And as well, all the way to the right, here you can see a guideline that is actually for veterinarians as they come and do some advisory visits. These are different questions that can be good to ask and to make sure that you talk with the farmer about. And then they also created a checklist in order to do so. So it is a very applicable kind of material that they produce in this campaign. And this is definitely for a good benefit of the farmers and users. So in conclusion, at least in Denmark, co-creation has really proven to be essential in the implementation of the rules. And we really see that by involving all stakeholders, both farmers, the industry, the veterinarians and authorities, etc., then the implementation and compliance become more of a shared responsibility. And this way of doing collaboration helps the farmers get a more practical and actionable solution, which is tailored to the real farm conditions that they have. So all in all, this is a very, very important thing and something that we at least utilize in Denmark in the sense that it is possible. But that was it for me. I hope I was okay on time. And yeah, back to you, Jane.
Oh, Louise, thank you so much. That was really valuable, talking about that practical changing words into action. So thank you. As we have just discussed with everyone else, please do, if we have any questions, pop them in the Q&A. I'm not seeing any arriving yet from our attendees, so I do encourage people to think about what questions they might want to ask the panel. But Louise, thank you. I'm now going to call on Nancy to turn her camera on and be ready to do our presentation. For those of you who don't know Nancy, who doesn't know Nancy, Nancy de Bruyn is the FEE Executive Director. She's a veterinarian and diplomat of the European College of Animal Welfare and Behavioural Medicine, and has guided the FEE in various roles for half of our existence. We're very proud of her. So Nancy, if I could ask you to carry on with the FEE's presentation, and over to you.
Thank you very much. Can you see the presentation well? Yeah. All right. That's super. So yeah, thank you for this webinar and all for being here. So just to go a little bit back on the topic of animal health lab visits, because this has been a topic for FE, really important topic for many, many years. Already before the new rule, Article 25, came into force in 2021, FE set up a working group to try to give more detailed recommendations on how such an animal health lab visit could look like and what should be included and on the frequencies and things like that. So this position paper developed by experts in different species fields was adopted by our General Assembly unanimously in 2021 already. And if you haven't seen it, it's on our website. So in 2023, 2 years after the regulation, the animal health law was into force, we wanted to see what was the situation. And we did a large study to look at who performs these types of visits, are they mandatory, which type of holdings, the coverage of holdings, and so on. And we really were very generous in our scoring, because we didn't include only the official animal health law visits according to Article 25, but like Barbara also mentioned, all preventive veterinary visits done in different countries for different species, also, for example, by quality assessment, assurance systems, and things like that. And what we saw, and it's also similar to what was presented by Barbara, is in none of the countries it was perfect, and in some countries there were no visits at all. So we also looked at the objectives of these visits, and as you can see, in most countries they are combined visits, so they're not only for biosecurity and early disease detection, but also include animal health data, treatment data, medicines use, and so on. And of course, that makes sense, because if you do a preventive visit, you want to look at everything together, not having different visits for different aspects. So what also became really clear is these visits are really a win-win-win situation. They're a win for operators and farmers, obviously, because if you can keep your animals healthy, you have to use less medicines, their productivity is better, but also win for society and the agri-food sector, because it enhances the protection against endemics and pandemics, and it also gives more transparency and more trust in the system. And it's a win for regulators, because they can do, for example, more risk-based approach for official controls, and they can ensure that there's more enhanced biosecurity and surveillance. So as I said earlier, these are advisory visits, and we totally are on the same line there. There are no official controls. The vet only advises and the operator decides. And in most countries, they're done by private practitioners with a clear contract between the veterinary team and the operator on the task, the frequencies, and the responsibilities. But what we also saw is there's really a need for these to be risk-based, flexible, but on the other hand, really some harmonizations and some minimum criteria to ensure that we get a level playing field. So just as to finalize, to turn Article 25 into action, which is really needed. It's now 4 years after the regulation is implemented. We'll still see in some countries that it's not implemented at all, and we are at a time where there are enormous amount, much more than we want to have, disease outbreaks. So it's really time to turn Article 25 into action, and for that, to do that, we need more guidance and clarity, so that there's at least a minimum level of implementation across the country. This will ensure that we really have a win-win-win situation, and that the benefit of preventive veterinary care can really be coming up. And it has to be done, of course, like was said by Louise, via collaborative approach between all the different players, and a co-creation, but a co-creation of guidelines, guidance on a European level, as this is EU legislation, and we don't want every country to do another level of implementation. Thank you very much.
Thank you, Nancy. And now is the moment to call on our speakers and our co-hosts, COPA-COGECA and FESASS, to turn their cameras on so that we can start to have a panel discussion. And I would like to start that by introducing our co-hosts. First, Miguel Angel Guerra, who is the chair of the Animal Health and Welfare Working Group in COPA-COGECA. He's also the vice chair of the Pig Meat Working Group and serves on several expert committees of the European Commission relating to animal welfare, antibiotic resistance and pig meat production. We're really delighted to be co-hosting this webinar with you. And then Chris Van Melveren is the FESASS Delegated Vice President and an experienced Managing Director with a strong background in consultancy and the veterinary industry. Chris holds a master's from Wageningen University and has completed non-executive board roles at Erasmus University in Rotterdam. And again, absolutely great to be co-hosting this webinar with FESASS. Chris, welcome. I'm just wondering whether we still have Barbara available or whether she's had to leave.
No, you have
Here is Barbara. Here we go.
Sorry.
So, please don't apologise. what we have is a little bit of a flexible agenda now. So we have the opportunity to have a panel discussion and to answer questions from the virtual floor. We haven't actually got any questions in the questions and answers, so I would very much encourage people to consider that. But equally, a number of us are also going to do some little case studies from different experiences. So what I think might be best in order to generate the conversation, and I hope everyone is ready for this, if I start to ask a few questions for people to be thinking about, and perhaps put into the questions and answers. And then we go straight on to the case studies, because I think that will generate a little bit more conversation. So the discussion points that we're thinking about together are, how can we increase the uptake of preventative visits? What type of support is needed to ensure their success? How can we measure and demonstrate that impact on animal health and farm resilience? How can we, as Louis said, turn words into action? So if people could just be maybe thinking about that, I'm not going to pose those questions immediately. What I'm going to do instead is talk about examples of implementation in a number of areas. There's a case study from me, which I'll probably go last, from the UK. And I'd really be grateful if Miguel could talk about the case study that he wants to talk about, and also ask Simone, who is the Managing Director of the Animal Health Association in Austria and specialised in animal health and welfare, leading the Animal Health Association Austria and coordinating aspects of its operational and veterinary activities, an interdisciplinary approach to delivering science policy and industry and being strategic about that. So Simone, if you could also turn your camera on as well, and if I could hand over to Miguel.
Okay, thank you so much. So I want to try to share my screen. If something is wrong, please tell me in advance, because I think
Miguel,
you
it is
also
perfect.
Yeah, I think so, that you are also seeing my screen. So first of all, it's very appreciated also for all the colleagues that we have organizing this meeting, because I think it's quite important also in the behalf of the farmers. So thank you so much for all that are already connected with us. And we are going also to try to give an example about the best practice that we have also implementing in the animal health visits in the pig sector. So COPA-COGECA represent all the animals, but also in my expertise is more related with pigs. So I would like also to speak about it. Okay. We have also the animal health law, animal health visits. So we have also to try to be focused about how we can manage the individual animal health, how also we can move for the health status in the farms, and also for the regional health control. So everything has to be controlled, and also this kind of thing is very important for the farmers. This is a map about the density of the farm that we have in pig production in Europe. So you know that there are areas that there are more density of animals. The sample that I bring is one of that we have in the north of Spain, that is in the region of Catalonia, and it's a group of veterinarians that are working together with the farmers, and also with the professional and the private veterinarians that are working in the companies. This organization is a non-profit association, so it's created only for the animal health proposals. It was created and also increasing because it has multidisciplinary teams with veterinarians, biologists, microbiologists, because also working with labs, biotechnologists, agricultural engineers, and also laboratory technicians. Also, the commitment that are working focusing is in the biosecurity, animal health, antimicrobial reduction, and innovation. So they are working also in the collaboration, coordination, and control. This is the region that we have more density of farms in Spain, that is in Aragon, in Catalonia. What's happened in this region that in another part of Europe, that we have a combination of different companies, different farmers, different veterinarians that sometimes are working independently, are working individually in the farms, and there are not connections. So for this reason, we create the GCP data. Is a group of non-profit that try to organize and combine all the issues that are related with the animal health in all this region independently, the owner of the farm and also the veterinarian or the practitioner that is working in this farm. So for this reason, there are some aspects that are absolutely dedicated and is not included in the part of the companies. It has to be also more horizontal and also have a more wide approach, that is the surveillance. So go to the farms and make the visit. Make also the biosecurity surveys to provide advice also for the farmers in terms of biosecurity, analyze also with the trucks, the technical training and also the technical advice in all the visits that they have done. Also, they have a laboratory because we think that this has to be together to provide advice. So it's a laboratory that is officially recognized also to take sample for the competent authorities. And this is something that is very easy to do with the farmers and also with all the different kind of diagnosis techniques that they are implementing. And it's very easy to do because at the end it's a private laboratory that is working directly with the farm. So the agility that we have is quite important. We will go to the most important part, that is also the share of the information. It's not only important to make the visits and also to coordinate veterinarians, companies and farms, also because we have a digital innovation that is an app that you can download, is in the apps and register, that you have also the following of the cases that you can find in the farms. That is the most important, because with these apps, all the veterinarian, not only the veterinarian of this group, all the veterinarian, the practitioner, the private, has access to the clinical cases. So you, with this app, can upload what is the result that you have in the laboratory and tests. And this information has to be shared with the others. Why? Because with this information, you are related what is the sanitary situation that you have in an important area. And these clinical cases are open, closed, and this information is shared with all the veterinarians that are operating in this area. So at the end, the sanitary status of the farm is going to depend about the sanitary status of the other farms. So we need to have this connection between these different farms. So for the veterinarian, it's very fantastic tools, because when they arrive to a farm to have also monitoring some problems, they can also know what is happening in the surrounding farmers, in the areas, about what diseases, and also we are together working with our ministry, because in this tool is also included the monitoring of antimicrobial resistance, so to give a first advice to the private veterinarian to know exactly what is the first use of antibiotics. So at the end, this is the last presentation. When we are talking about a group of people that are working with the farmers, we have all the aspect that has to be involved between farmers, veterinarian laboratories, cooperative farms, integrators, science, pigs. But we need something that also make this connection between everything. So we have to have any horizontal one that move together all the sanitary aspect, and also they have not any competence in the farms or indirectly in the business, but at the end you have an external advisor for the animal health to be sure that all are working in the same direction independently, if you are for the same company, different company, the same farm or different farm. Thank you so much.
Miguel, thank you. I think in English we have an expression, knowledge is power. And it allows you to take action. And I think this is, it's really great, and using technology to build that knowledge and share that knowledge is wonderful. Thank you. Miguel, something seems to have frozen. I think it might be my side. But if I could ask you to stop sharing, and if I could call on Simone, who I believe you're also representing FESASS in your best practice as well. So if I could call on you, please.
But I'm a very new member of FESASS. Yes. Yeah, ladies and gentlemen, dear colleagues, I'm happy to welcome you to my presentation and on how the animal health visits are implemented in Austria. I hope you can see my presentation.
Yes.
I think
Perfect.
so, yes. Yes, in 2023, the Animal Health Austria was founded, and it's an association with members from the fields of veterinary medicine, agriculture, animal health services, and also industry. And together we work on the improvement of animal health, animal husbandry, and biosecurity in the livestock sector. Our tasks are defined in the Austrian animal health law. And one of our main tasks is the coordination and support in the implementation of the animal health visits. Animal Health Austria is also the umbrella organization of the animal health services of our Austrian federal states. And in the framework of these animal health services, a contractually agreed care relationship between the private veterinarian and the farmers exists. And in regular mandatory farm visits, animal health and proper use of medicine are monitored. The frequency of the visits depends on the farm size, and a continuing education program is required for the dispensing of medication to the farmers. The animal health services are a voluntary system, but they are prerequisite for participation in many Austrian quality and brand programs. Therefore, the number of animals in the animal health services is high, especially in pigs, poultry, and also in ruminants. The proportion of farms is lower because we have a lot of really smallholder farms with only 2 pigs or 5 cattle. That's the reason. During the farm visits, there is a focus on animal health treatment and the documentation of the treatments, but also on animal husbandry, welfare, the health status, and farm and health management. And there's also time for advice and the opportunity to ask questions to the veterinarians. Due to the high animal health status of Austria and Austrian farms, little focus was paid on biosecurity so far. However, the animal health and disease situation in and around Austria changed significantly the last year, and we have to focus on knowledge transfer and on biosecurity. And we started to organize free webinars for farmers and veterinarians in the animal health services, always in cooperation with the Ministry of Health in Austria. And we recorded the webinars and provided them on the websites of the animal health services and also on the websites of the breeding organizations. And we learned that our member group, the dairies, they were particularly successful in distributing the invitations, and we had a very high number of participants, especially in the webinars on blue tongue, foot-and-mouth disease, and biosecurity. The next steps to further develop the animal health visits are an increase in the number of participants in the animal health services. We have to create attractive offers, especially for smallholder farms, and we have to focus on biosecurity. We have to support our veterinary practitioners in providing advices. I think as everywhere in Europe, we have not enough practitioners in the livestock sector, so we have to support them by trainings, and we have to create information material. We already started with this, that they can give to the farmers. And last but not least, we started to work on a database risk assessment, including data on farm size, animal species, animal movement, proximities to slaughterhouses, collection points, and surveillance zones. And these risk assessment will be provided to farmers and veterinarians for the animal health visits in our new database. It's called Animal Health Data Service. And right now, reports on the antibiotic use, the results of examination of slaughter animals and calf mortality are provided to the farmers. Yes, and with that, I want to thank you for your attention.
Thank you indeed, Simone. Again, using technology to bring together this information. And I'm starting to see some questions coming into the questions and answers as well. So thank you for that, everyone. If I could ask Simone to stop sharing her screen. It's a beautiful picture, but let's bring the panel back onto the main screen. I'm just going to do a very brief update from both an FEE and a UK perspective. And first of all, I'd really be grateful if Felipe could actually, in talking about knowledge transfer, put into the chat or to the Q&A the links to the animal health webinars that we in the FEE have been delivering recently on high-path AI, blue tongue, foot and mouth disease, and so on. This is all an important part of the resources for knowledge transfer. And the most recent one was on lumpy skin disease. And then I just wanted to say, I've got a presentation. I'll put some links into the Q&A. A little bit about, in England, a system called the Animal Health and Welfare Pathway funded veterinary visits. There's a similar process in Wales, that's called the AHICS, the Animal Health Improvement Cycles. And of course, we are operating outside of the EU at the moment, but then we still see the value of the animal health visits. Similarly, there will be systems in Scotland and Northern Ireland that I'm not so familiar with. So the Animal Health and Welfare Pathway funded vet visits constitute a farmer being able to choose their vet to carry out a visit and carry out testing for endemic diseases. So in cattle, that's bovine viral diarrhea. In pigs, it's PRRS, and it's worming resistance in sheep. And what the visit will do is it will give a tailored health and welfare discussion between the farmer and their vet, and it's designed to help farmers to build healthier, more resilient livestock systems. That means practical advice to support productivity, animal welfare, and the farming business. And then also a choice to have a follow-up visit. And that can be focused on deeper sampling, biosecurity planning, and action on these priority diseases. Funding, we've got some questions that are going to come up about how can we encourage animal health visits. And I think funding is a really good encouragement. And that's available for every eligible herd or flock in England. It's around £500, €550 for each initial visit. But there was also some scaled funding for those optional follow-up visits. And that particularly increases for beef and dairy herds where BVD is present and therefore is being addressed. And then you can have an annual review as well for every eligible herd or flock. Now, what I'm doing here is just talking about the process. I unfortunately don't have a farmer with me to tell you about how it has been for them. But if you follow some of those links, there are some little videos that actually do talk about how it feels to be a farmer or a vet carrying out these funded animal health visits. And I definitely encourage you to click through to those and actually listen to the people who are doing that job day in, day out. So I'll pop those links into the chat for everyone. And we'll now move on, I think, to the questions and answers. I'm not necessarily going to do this. Oh, Veep has already put some of the links into the chat. That's brilliant. I'm not necessarily going to go to these in the order that they have been asked, because I've just talked about veterinary practitioners, and I wanted to come first to Giovanni from UEVP, our practitioner section of FEE. And he has asked, he's also a pig practitioner, Miguel, I'm sure you know Giovanni. Practitioners have a key role in health management of farms. It could be more useful to have a uniform scheme. What do you think about monitoring clinical signs, production parameters, mortality, welfare, and collecting data with farmers? This could be really effective monitoring and controlling EU farm health status. So I am actually going to take this question first to Barbara, but then please to my other panel members. Barbara, do you have a view on this?
Thank you, Jane, and thank you for the question. Well, for sure, the question is very valuable, and my view is certainly this makes a lot of sense. Making such sort of visits that the the colleague, I don't see his comment in the chat here that he mentioned, certainly makes a lot of sense. And I think that the presentations, I mean, Louise and Miguel and also Simona, they have showed that they are already practically doing in a different ways, but exactly taking this approach. And it's with great pleasure to observe these well-developed and meaningful, I would say, practices.
Thank you, Barbara. And if I could actually come, Chris, perfect. Thank you for putting your hand up. Please feel free, anyone on the panel, to come in.
Yeah, thank you, Jane. Yeah, of course, it's a great question, and also the answer is more or less clear. But we discussed it in our federation, and we are of course a little bit afraid when you're reporting too much data on farm level, that the trustfully relationship between the veterinarian and the operator, the farmer, would be under a threat. It's good that it's very open, that every problem can be mentioned, etc. So reporting problems also for other farmers could probably be something that is done on more on a regional or on the country level, and not on an individual level. Also taking into account one of the remarks of Barbara, that we don't want to increase the administrative burden, that there is lots of reporting. And of course, in 90% or 95% of the cases, there is nothing to say, but you want to focus on the last 5 interesting percentages. On the other hand, guidelines can be very useful, just to make things more comparable. And another thing which was not yet mentioned is that we see that for the professional farmers, the professional livestock holders, there are lots of visits and there is lots of interaction with the veterinarians. There is lots of opportunity to discuss, to exchange ideas, to give training, etc. But there are also in some region lots of small farmers, the backyard farmers, and there you often see no veterinarian in 2, 3, 5 years. So one of the things we should also think, how can we involve these people? And is then a visit a good option? Or should we more provide trainings, more on a community level, that there are 10, 20, 50 farmers together to train them and involve them? So that's also one of the issues to think of. Thank you.
Yes. Thank you, Chris. I think that's really, trust is the word that hasn't been raised yet, but it's absolutely vital, trust. But also accessing those smallholders. They are not professional farmers, and they actually may also have day jobs. So the normal access is not available. If I could come to Simone next, and then Miguel.
Yes, I want to come back to the data. I already mentioned our new database, Animal Health Data Service, and we use data that already exist, that do not have to be reported newly. And we have data about calf mortality, the antibiotic use, and the examination of the slaughterhouses, and we further developed this database. And in this kind of system, only the farmer and his private veterinarian can see the data. So they know them some kind, and they can talk about them together. They get nice illustrated reports, and we hope that they use them in the future. And we want to bring the results on our checklist. If the farm visits start, then it's almost fulfilled with these reports and a kind of color system, red for things we have to discuss. And that's our way. Only the 2 of them can see the data and no one else.
Thank you, Simone. Yes, confidentiality is really important, isn't it? But also deploying existing data, not creating new burdens. And we have so much information, and bringing it together to use it in an intelligence-led way, I think is really what we're starting to see from some of the apps and the work that you guys are doing. Miguel, you had your hand up. Put it down again.
No, I got down the hands to take the floor, so I apologize. I make it in advance. So it's a good question that Giovanni has put on the table, because at the end, when we are talking about the management of the farm, as more information you have, better for the veterinarian private practitioner. So, but as Simon said, it's a relation between the practitioner, the clinical veterinarian, the management of the farmers, who has to be this information together to improve the management system of the farm. So that's clear. When we are talking about the veterinary health visits, we have to be focused in what is also the recommendation to try to be also the front of the diseases, and also has a coordination between all the farms. And also, as Chris said, there are differences between species, there are differences between territories, there are differences between a lot of different things that we have to consider when we are talking about the high professional farming, like poultry or daily farms. It's clear that there are not any way to proceed to have all this information and to try to build this relation. That's the trust that you have set between the farmer and the veterinarian. But obviously, when we are talking about the data for the farms, is something that can be also send critical these informations to the farmers. So, and this critical information can be used to build or destroy the trust relation between the farmer and the veterinarian. So it is clear that the veterinarian has to provide the information, and the farmer has to trust in the veterinarian. So I agree that it's not needed to increase also the bureaucracy borders, because we have already a lot of information that is right now very useful to know exactly what is the situation and the whole situation in one regions. That is quite important for the veterinarian visit, so that the health status of the farm has to be also put in the context of the health status of the area. For this reason, the veterinarian visit is fantastic. We can share this information to know exactly what is the positive information, but between farmers we can share. The other one is some part that the farm and the veterinarian, the practitioner, has to consider to take the decision of the farms, taking all this information, but it's more private information.
Thank you, Miguel. And I'm going to come now to Louise, and then we'll perhaps move on to another question, which actually is very linked, but we'll go Louise first.
Yeah, sure. Thank you, Jane. Yeah, I just wanted to say also very similar to what Simone mentioned, the way that we at least organize these animal health visits, or some of them in Denmark, is based on these specific type of agreements that the farmer has with the veterinarian. And the way that these visits are arranged is actually based on 4 different categories of arrangements or visits that they can choose from. So it is depending on, you can go all the way down to, you have 2 visits a year, all the way up to 26 visits a year from a veterinarian. And I think in this way also, it opens up a little bit depending on what intention the production has and the capacity that the production has. So this opens up a little bit of a not one size fits all approach, but that they can differ a little bit. But I remember also, which could be potentially also a little important detail, that when we have been discussing these types of visits with our Danish Veterinary Association, one of the things that they also mention as actually a challenge for them is that if they do not, through the legislation, have a little bit more of a detailed guideline, sometimes it can be a challenge for them if they go in to a farmer and advise a little bit too strict. Because if they do so, the farmer has the potential to choose another veterinarian, and as they also run a business, this is actually a risk of them losing a customer. So it is a good balance between having the legislation supporting the level of advisory that is actually needed, but not to a degree where the veterinarians feel like they stand a little bit alone in this and risk losing customers. Yeah.
Yes. And we come back, I think, to Nancy's presentation from the FEE about the win-win-win.
Yeah.
We need to find the way that it works for everyone. And I think that's really important as well, Louise. Thank you. So I'm going to come back to a more general question, and then there are some specific questions for individual presenters. And this one is from Claire. It's actually the first question that was posed. And what Claire says is that studies consistently show that prevention is cheaper than treatment and disease management. I think we can all sign up to that. At a time when costs are front and centre for farmers, how can we better encourage the uptake of preventive healthcare? And this is actually something that's very close to my heart as well. I work for the Food Standards Agency. We have information about subclinical diseases in healthy animals, for example, liver fluke. Is there a way for that, and I'd be really grateful for panel members to put their hands up as to who wants to come in on this, how we can potentially actually show the cost benefit or the opportunity cost of not treating animals or not applying husbandry methods to avoid, for example, a liver fluke field, and then also ensure that we have responsible use of our medicines. So it feels like there could be some ready reckoners or something like that that just help a vet to talk to a farmer about the value of the preventive healthcare. Who can I come to on that? Could I come to Chris first, perhaps? Oh, Louise, thank you for rescuing me.
No, sure. But I think it's a very good question. And it is also, of course, a challenge. How do we engage these people who might not necessarily see the benefit of it already? But I think in that case, partnering up with perhaps people who already have done the practice that you can refer to and that they have a trust in, I think is one way of coming around this challenge in some way. Because of course, if you don't see the immediate effect of it, because it's not necessarily immediate, it is something that is developed over time with a good and consistent practice, then it can be an idea to look for people who already have done it and show it through that as one way. Yeah.
Champions who are perhaps trusted because they are fellow farmers, could really help in that space. Miguel, I wonder whether you can speak on that.
Yes, thank you. It's quite most of the part that is quite important, because at the end we are telling always that prevention is better than cure. But also this statement has to be supported, and we have all this information right now. So this is fantastic, because in a lot of Congress symposium and also articles are a very nice link and relation between the disease prevention, biosecurity, and also the performance of the farm. For example, that we are doing in Spain, and also it's different because we have a model that is in combination and integration model. So the companies and also the farmers has a lot of farms, and they can compare with that. But at the end, you have a lot of information, and we would need to know, establish a perfect relation between the level of biosecurity, level of the protection of the animals, so what vaccine you are implemented. So with these two things, you have a score about how is the level, the aptitude that you have, but also you can link with the animal health index to know exactly what is the progress that you have in the farms, and also with the productivity. So with these three aspects, you can show perfectly to the farmer how is the impact of the high levels of biosecurity and prevention, what is the impact in the animal health index, and also in the productive measures, because sometimes for the farmer, maybe are more focusing what is the performance in the farm, relation, and the relation and duality. But it's needed also to solve the farm, because maybe the farmers need to know exactly what is the numbers and what is the relation. For science, we know that the relation exists, but if we have also these figures and this data, will be fantastic. And also in all our information that we are managed, is fantastic. You see the relation between the preventions, the biosecurity with animal health, and also, of course, the performance of the farms.
Thank you, Miguel. Yes. What is the return on the investment, and what is the investment is going to have the biggest impact in order to make those decisions? Yeah. Chris.
Yeah, just a small comment, and mainly to support the idea, the vision of Louise, also about the co-creation. It's about working together with the farmers, with the industry, with the veterinarians, etc. And as long as you are doing it together, you're creating awareness. And of course, it will never reach 100% of the farmers, but the majority you will reach. And as long as you also have the flexibility there, depending on the region, on the kind of livestock, etc., I think that's the best way to convince the farmers that being involved is just, in the end, a very good investment for them.
Yes, absolutely. And it has to be flexible to the conditions for the individual, for the area, and for the country. Exactly. Thank you, Chris. Yeah. Barbara.
Yes, indeed, I can mainly echo what everybody is saying, because it's a very nice discussion here, and I would like to come back on what Chris was saying earlier. A really important thing is trust and collaboration, as Louise was saying. So these are the exact examples that can lead us towards a greater update of the animal health visit. What I'm very much happy to hear is from Miguel, where you are saying that we have some data available that can show what are the benefits of these visits and what are the benefits of the prevention, because like for us, let's say in a global level, is sometimes it's very difficult to show costs, but in this very difficult situation with diseases that we have right now, is difficult to show our farmers the benefits of prevention. And if data on this exists at your level, that's extremely valuable. This is what I wanted to add here.
Wonderful. So Barbara, thank you. That is a call to the countries and the organizations that are delivering that best practice and bringing this evidence forward to share it at a confidential level with the Commission, so that they can really help to provide that evidence base to make legislative changes if and as they're needed. It's really important to have that evidence, isn't it? Thank you. Miguel, right. Do you want to come back in?
Yes, only to follow up also the reaction of Barbara is that, for example, 2 years ago, we made an operational group in Spain together, farmers, Ministry of Agriculture and Medicine Agency. Farmers provide information about the performance of the farms, the Ministry of Agriculture, the surveys of biosecurity, and the Medicine Agency, also the consumption of antibiotics. All together, farm by farms, we making a fantastic study to work together in these 3 aspects that usually are disconnected because it's in different hands, and we put together in the same databases to go in this direction to show that improving the biosecurity, you reduce the use of antibiotics, and also the performance in the farm is great. So these figures are there, and I think it's something very, very easy to show to the farmers.
Wonderful. Miguel, I think we'd all like to see that. So maybe we can take that as an action following this webinar. Thank you, everyone. I've got a couple of specific questions for individuals, but that might then trigger additional conversation. They're all linked, of course. And the first one is for Simone. To ask, how does Austria encourage farmers to establish biosecurity management plans? How do farmers respond to these initiatives? And does their response depend on the type of domestic animals they keep? And if so, how?
Yes, it is so. As I already mentioned, we have a really high animal health level in Austria. In ruminants, we are free of BVD, free of IBR. So our farmers, it was never necessary to care for biosecurity. They're celebrating parties in the stable, other farmers come. And now we have this new situation with the threats of the infectious diseases, and with the cattle and small ruminant farmers, we have to start in the beginning. We have to bring them knowledge about the infectious diseases and how they are transmitted. And therefore, we started with these high amounts and high density of webinars about the infectious diseases. And there was a really big interest of farmers and also veterinarians. And we shared the webinars, and veterinarians used them to provide them to the farmers, that they were not, they don't had to talk to the farmers. They could just revise to our webinars. In the pig farmers, it's a little bit easier because of the threat spread of African swine fever. We talked to them for a long time, and they are in close contact to farmers to Germany, and yes, they know the problems they have and also the economic problems resulting from the disease. We now have problems with blue tongue. It also reached Austria with a lot of clinical cases, and that was a little bit of a wake-up call. The first time for years that infectious diseases came to so many farms at the same time. And we had a lot of people who didn't want to vaccinate, and now we have the disease, and now they start to think they have to do something. So sometimes a bad situation is necessary to start to think about biosecurity, and we will provide webinars, information. We have a big fair where we explain the diseases and showed information material, and we have to go on, I think.
Yes, thank you, Simone. And I think it is difficult, isn't it? I come from the UK, where we had, as everyone knows, a very big foot-and-mouth disease outbreak in 2001. And that was absolutely devastating for all concerned and for our economy. And yet it's really hard to remember that, even though it was so impactful at the time. We're now 25 years beyond that, and another foot-and-mouth disease outbreak. And yet still, you know, sometimes you can be quite short-term, just think, what is the thing I need to do now, rather than thinking about that long-term approach. So all of the things that we're talking about are those investments, and we need to be able to make the case for that investment. And talking of making a case for investment, there is a question for Louise, which is about the average cost of the animal health visits in your framework of the herd health management advisory agreements. Is there a price per visit? Is it a yearly lump sum payment? And perhaps others may want to comment on the cost of these visits and how we can show the value of them.
Yeah, sure. Well, because we have we have these 4 different agreements that the farmer can choose from. It is going to be different from one farm to another how much they pay per year for visits. But for the first of these agreements that you can choose from, it is going to be 2 visits per year, and it is a payment that is paid by the farmer. It is not something that the authorities are involved in. So this is solely the farmer who has this responsibility. And how much this costs will also depend on the veterinarian. But we do also have an agreement where the veterinarian visits 4 to 9 times a year, and then we have if you can say so, the most difficult or the most manageable agreement where you actually have 12 to 26 visits per year. But I would say that, and of course this will depend on which level of visits frequency you decide on, and this is going to be in collaboration with your veterinarian. But if you are having the agreement number 1, then it's going to be at least 2 times per year. If you have agreement number 2, it's going to be 1 time a year you have a veterinarian, and then you also have to go to a special kind of school for education for the second time. And then for the third, it's going to be these 4 to 9, for the fourth, 12 to 26. But what is, I think, what this way of dividing these agreements actually gives the farmer a possible solution for is to get a frequency of visiting that is needed for the farm. So you don't have just one type of visit where you need to have at least 6 times per year. If it doesn't make sense, then it's going to be 5 times per year. And I think this way of doing it gives the farmer the possibility to see what is within their range and what they are capable at achieving. But the exact price will differ from farm to farm. Yeah.
Yeah. But again, I think that's important, isn't it? It's tailored to the farm, to the situation.
Exactly.
And there is not one size fits all in these situations. Just there are a number of other questions. One very technical one, Miguel, for you around your app and whether it is geo-linked, geotagged photos, etc. I'm not going to ask you to necessarily answer that one here in the panel, but we'll take any of those questions and comments away to make sure that we do come back to you all with relevant answers. Some of them are comments. Others are, for example, sharing, and Claire, thank you for sharing the Animal Health Europe resource on the trend reports around animal health towards a more resilient and sustainable future for Europe. Really helpful. I'm going to ask if everyone from the panel, and they didn't know I was going to ask them this, so I apologise. If you could give one sentence as to your key takeaway for this webinar. It could be a word or a sentence about what it is that you think has been really important here. And I don't know which way round we want to do it, but I'm going to start. I'm sorry about this. Louise, you are first, so you have less time to think about what your one word or sentence is.
It's absolutely fine. I would say start where you can and search for collaboration.
Collaboration.
Yeah.
Brilliant. Thank you. Simone.
For me, it's important to support the veterinarians because they have so many work to do and they have to advise the farmers. I think we have to support them.
Support. And this is not just the vets, but also the farmers. Thank you. Miguel.
I think that the veterinarian and the farmer is the front line to the prevention of the disease, and they have to work together, collaborate, and in a very strong trust one each other. So this relation has to be stronger to be the prevention of the diseases.
Yeah. So strong and trusting relationships. Thank you, Miguel. Chris.
Yeah, I also want to mention the word trust, but it's already given by Miguel. So I would go for the word flexibility.
Flexibility, yes, suitable for the situation.
For the situation, yes. Yeah.
Thank you, Chris. And Barbara.
And yes, well, a little bit more horizontal head on, I would say proportionality and subsidiarity with all these elements that were mentioned earlier.
Excellent. Thank you, Barbara, and thank you all.
Thank you.
So as we are coming to the end of the webinar, I did want to just thank you all so much for taking part. It's been really engaging and thought-provoking. I think we've all heard that preventive animal health visits are far more than a legal requirement. They're a chance for real partnership between farmers, vets, allied professionals, and they build on, there's that word, trust, dialogue, and prevention rather than reaction. There's a few key messages that I think we've heard and that stand out. From the FEE perspective, we really are looking for a consistent framework across Europe to really deliver that genuine value everywhere and still allow flexibility into national contexts. I'm loving how this is all coming together and the same words are coming out. We're wanting to strengthen joint training, communication and data sharing, making each visit meaningful and a two-way exchange. And we should ensure, and this didn't come out, but it was implicit in everything, that we have practical and financial support and scalable guidelines so that the visits are feasible and beneficial for all farms, whatever their size. The examples that we've shared of best practice from Denmark, from Austria, from Spain, UK and others show that collaboration really does work. There's continuity and shared purpose in everything that we do. And these are lessons that we can build on as we move forward. So our next step will be to bring together today's insights in a joint report from FEE, COPA-COGECA and FESASS. And we hope that will shape discussions with the Cypriot and the Irish presidencies in the months ahead. And together, we're going to continue to make the case that preventive visits should stand at the heart of Europe's animal health strategy. So, thank you. And finally, a really sincere thank you to all of our speakers, our panelists, and for our audience who've asked great questions and have stuck with us on what's quite a long webinar, an hour and a half. I hope you find it helpful. It's this sort of collaboration that we think, crossing professions, crossing borders, will help us to keep European livestock farming healthy, resilient, and forward-looking. Thank you, everyone. I wish you a really pleasant rest of your afternoon and a lovely weekend ahead. Thank you.
You too, Jane.
Thank you.
So much.
Thank you very much.
Thank you very
Bye-bye.
much. Bye-bye.
Bye.